Virginia Beach, and I hereby call this meeting to order at 6 o'clock p.m. on this 20th day of December 2021. We welcome those in person today to joining us and also our listening and viewing public. Pursuant to the Virginia State Health Commissioner's Order of Public Health Emergency statewide requirement to wear masks in K-12 schools issued August 12, 2021, and Virginia Acts of Assembly number 1303, Chapter 456, and CDC's guidance for K-12 schools. And finally, the school board's 2021-22 reopening plan adopted August 10th of this year. It's determined that physical distancing will be used in school board chambers as a health mitigation strategy. There is thus designated public seating during this school board meeting. As always, members of the public are also able to observe the meeting through live streaming on vbschools.com, broadcast on VBTV Channel 47, and on Zoom. Pursuant to Bylaw 146 and Virginia Code 2.2-3707, at the request of 3 school board members in writing to the chairwoman and the clerk or non-VHSL program, and 2, discussion and vote on resolution to make masks optional in Virginia Beach City Public Schools. Please note, no public comment will be taken at the meeting. The school board does invite the public to submit comments through our group email account. And with that, Madam Clerk, would you please note those in attendance?
Thank you, Madam Chair. Present in school board chambers is Chairwoman Rye, Ms. Melnick, Ms. Anderson, Ms. Felton, Ms. Franklin, Ms. Holtz, Ms. Hughes, Ms. Manning, and Ms. Riggs. And present via Zoom is Ms. Owens and Ms. Weems.
Thank you. And for the record, Mrs. Weems is zooming in for health reasons, and Ms. Owens due to a prior work commitment that's scheduled prior to the...
I'm sorry, Madam Chair. I spoke with Mrs. Owens earlier, and she indicated that there's a family health situation. She didn't want to get anybody sick in the school board, so she did indicate it was for medical reasons.
She was the second member. So, okay, that's on the record for both our colleagues. So that leads us to the adoption of tonight's special meeting agenda. Motion to approve. Mrs. Holtz, thank you. A second. Mrs. Manning, all in favor, please show a raised hand.
Ms. Owens, how do you vote?
I vote yes.
And Ms. Weems, how do you vote?
Yes.
Thank you, Madam Chair. We have a unanimous vote.
Thank you. So that brings us to the first order of business. Discussion pertaining to student athletes being required to provide proof of vaccination and/or test for an athletic club or non-VHSL program. So I would respectfully ask one of the 3 colleagues who requested this to initiate this part of the program.
Sure, yeah. I wanted this to just be placed on our workshop agenda, but it wasn't allowed, so that's why I called for the special meeting on this topic. I simply wanted the board to have a discussion. I've been having behind-the-scenes discussions with administration. We had several parents that reached out to the school board via email, and I followed up with some phone calls with these parents who shared concerns that their kids were being mandated to either have show proof of vaccine or test weekly for COVID for a futsal club program. And, initially the response was we don't require that for our clubs. And then I was told that it was really an athletic conditioning program, but then parents shared documentation with me that did show that it was part of a club. There was a waiver that had been signed showing that it was waiving liability for the club, and some additional documents that were shared with me that indicated to me that it was a club program. So I had great concerns that we have some organizations out there that are being required to show medical information and test. So There was some back and forth, and ultimately it seems that the parents have been refunded their money, and that there has been a postponement. It's my understanding, based upon conversations that I had with parents, that this athletic conditioning or whatever it is, it has been postponed. So my question is, just to verify whether or not we are requiring athletic clubs to test, and because the data on the website and what was presented to us from the superintendent was that proof of vaccination or testing was only required for VHSL winter activities or athletic conditioning. So soccer is a spring sport, so even if it is athletic conditioning, it seems that this would not apply. And the futsal program is a club. So if anyone wants to provide clarification on that, I welcome it.
So good evening. I'll respond to that. First Colonial High School has been operating a futsal program for a number of years. And in fact, the last time futsal was able to play was 2020. First Colonial Administration, here with us tonight, Dr. Nancy Farrell and Holly Godfrey, can attest to the conversations that we had where they determined, as a school, that the soccer preseason conditioning program would include futsal. There were some mistakes made, and those mistakes were they used a registration form they've used in the past, and it came with a fee. The fee was used as a fundraiser. It clearly seemed to indicate to some that it was in a club format, although the school had determined that they were going to run futsal as part of their preseason conditioning program. Ms. Manning and I had several emails back and forth, and I confirmed with her that we will not require our club sports or organizations not affiliated with the Virginia High School League to participate in our health protocols. And so, to the question on for the information item, any club or any outside organization not affiliated with what's going on in a school, the students will not be required to participate in our health protocols. And so that's where we are.
Yes, Mrs. Manning.
So soccer is a spring sport, yet our policy says that it's for winter sports.
The conditioning programs normally occur in the season before their season starts. And so the preseason for our spring sports is right now.
In December?
Right now.
So you're considering this a VHSL athletic conditioning program?
It's part of their soccer programming for the soccer program at First Colonial High School, a VHSL program,
Okay.
and therefore
So this athletic conditioning was to take place on Sundays, which is not allowed by VHSL.
and it will not be taking place on Sundays.
Well, that was the plan, and the first match was supposed to be this past Sunday.
Yeah,
that would have been in violation of VHSL rules.
Correct, and it didn't happen because there were some mistakes made. and
Because
they have
I
been
asked questions about it, and so I'm just very concerned. I just want this clarified that this is serious, that we're requiring these vaccinations and medical testing of children, and this was a club. This was not.
And it is considered a conditioning, so therefore.
Part of their formal conditioning, sometimes referred to as a passing league, and 7-on-7 is part of the fundamentals that you learn as a football player. And teams participate in 7-on-7 leagues during the spring season in advance of the fall season. And I would characterize futsal as a 5-on-5 league. If you've ever thought about the dynamics of soccer, you've got midfielders, you've got backfielders, and you've got the attackers in the front. The 5-on-5 allows the coach in a setting to have those kids work together, which is so important in soccer, as evidenced by back-to-back or state championship teams at First Colonial in boys and girls soccer.
So the Show Me Your Papers protocol applies to all VHSL programs. Futsal's not a VHSL program, but we're requiring that anyway?
It's part of the First Colonial High School has determined that futsal is a part of their preseason conditioning program, which is well within their scope of responsibility to make that determination. And that's the way they're operating the program.
Even though they've never operated it that way before.
Correct. Of course, we haven't been in a pandemic before 2020 either.
Okay.
Go
Just
ahead.
for clarification purposes, I am a soccer mom and was for 24 years, so I can tell you that futsal is extremely important for developing footwork. That's what it does. It develops their footwork and their skills for soccer, so that in the spring, when they try to, pass the ball, accept the ball, etc., their footwork is readily tuned up. So that's what it's about, and that's why it's considered a conditioning activity now.
My questions were not about whether or not it's a good or bad program. It's just a matter of there were certain protocols that apply to VHSL. This is being considered VHSL so that you can require those protocols. It was never VHSL before. It was just a matter of, is it part of this or is it not?
I think the difference would be, like, a great comparison would be courthouse recreation coming in and using our building when we have students that sign up through a courthouse or another recreation organization and they come in and use our gyms. Those are the students that would not be required to show vaccination or to be tested. But when the futsal team is part of the student body, is part of the soccer teams at these schools, they're same children who are playing futsal are the same children who are on the soccer team. That's what we're talking about. And that's the difference. It's not rocket science. It's very simple. These are conditioning activities that occur in every single sport in the city of Virginia Beach. Baseball plays fall ball. They have conditioning in the winter. They're children who are either on the baseball team currently or will be going out for the baseball team during that season. And that's what this is. It's very simple. They're the same children.
Ms. Weems has her hand raised.
Go ahead, Mrs. Weems.
Thank you. I don't know if this is for Dr. Robertson or the principal. So futsal has been a program at First Colonial High School for how long?
At least 10 years.
At least 10 years?
Correct.
Okay, so has it been just First Colonial players, or have middle schoolers been able to participate, other high schoolers, or is it just only for the past 10 years, only for those First Colonial soccer players?
I'm going to confirm, Ms. Godfrey, that up until 2020, they also invited 8th graders that were going to be reporting to First Colonial High School from Lynn Haven and Virginia Beach Middle School. Otherwise, it's for only First Colonial students.
Okay, so it was for First Colonial students and the middle school students. Do other high schools have futsal, like does Cox, does Bayside?
There are other high schools that also have futsal, correct?
Okay, do you know if all of the high schools have it?
We have 4 high schools that do not have futsal. Is that correct, Mr. Rhodes? 6 high schools do not have futsal.
Okay, well, I mean, it seems, kind of obvious I get all the conditioning. I agree it's not rocket science. I've been involved with about every sport imaginable. They all have conditioning, preseason conditioning, but this was a program that was open to people outside the school for 10 years. And because of the vaccine questions, it has been retrofitted to then fit the guidelines of the part of the VHSL conditioning program, when in fact it seems like it has always been an extra program. So is everybody required, if you go to FC and you're on the soccer team, do you have to do futsal?
You do not.
You do not, so it's optional.
Correct.
Okay. Okay, so I mean, I appreciate you admitting, Dr. Robertson, that mistakes were made, and I'm glad that we're clarifying this, but it does seem like this is a program that's been, kind of rethought and retrofitted to fit the VHSL requirements for the vaccines. And like you said, the school can do that, but I just wish that it would have been done more openly and transparently. But thank you for the clarification.
Thank you.
And so I just feel compelled to state that most of what's been shared this evening has already been shared via email to the school board. And there were countless contacts between all those present tonight, Dr. Robertson, Dr. Saltner, Mr. Delaney, Principal Farrell, Ms. Godfrey. And so this was a school-specific situation, and it was being handled, and school board colleagues' questions were being responded, and yes, there was a lot of back and forth, and that was appropriate. But we get school-specific situations presented to us all the time, and they don't typically rise to the level of a school board meeting agenda item. So there was full transparency along the way, but because the situation was specific to a specific school, the matter was dealt with as many other matters, similar matters were dealt with. But here we are now with this as an agenda item this evening, and hopefully this is now put to rest.
Thank you.
Mrs. Hughes?
And you're correct that there were some emails going back and forth, but this is something that we've spent a whole 15 minutes on, so it should have been added to the workshop agenda for tomorrow to clarify. This does affect the public, this does affect students. We were just told that people outside of First Colonial, outside of, can participate. There should never be a problem with making sure everybody who may be interested in participating is on the same page with what the rules are with the program. And to me, that would have been 15 minutes well spent, and it should have been put on there.
Mrs. Manning?
Yes, and it wasn't clear to me when I requested this item to be added onto the agenda. It was not. Parents had not been refunded their money, and it was not clear to me if this wasn't happening in other schools.
Right, that was the first
So,
one. But
so I don't appreciate we shouldn't be talking about this right now, because that's what I just got from you.
No.
And this was brought to me by concerned parents, and to leave them out of this conversation is not fair. So I don't appreciate saying, oh, this shouldn't have been added to the agenda.
And I will just restate that there were many subsequent emails of explanation. So yes, I acknowledge the original questions were legitimate, but each level of questioning was responded to and answered with more collaboration. And that was my only point.
Well, but quite frankly, the refund to the parents and admitting that this was wrong didn't happen until I asked for it to be added to the agenda.
And all of this could have been taken care of by Dr. Farrell, Dr. Spence, and the administration with Virginia Beach City Public Schools, and not at a special meeting with Channel 13 and whoever else. It's sad. It is sad that we have administrators who handle this stuff every single day. They do, and it is their job to handle it.
So you
and
don't
this
want
is
the
beyond
public
our
to know
scope
what
of
we do.
understanding. The
Okay.
public knew. The people who were involved knew.
You don't want Channel 10 and Channel 13 to know what we talk about.
No, that's not true. It's just
It
that
is
they have
sad
a
that we're
job.
here tonight because you wanted to circumvent the public
ladies.
and not put this on the agenda.
I had the floor, and that was your job, Dr. Farrell, and you did it well. And thank you, Dr. Robertson. And I'm sorry that you were dragged through this. Sorry.
Please add Ms. Weems to the, she has her hand raised to speak.
Go ahead, Mrs. Weems.
Yes, I do agree with Ms. Melnick that this is very sad that we had to come down. Y'all had to come down here. I'm sick and I'm having to Zoom in on a Monday when this could have been taken care of on a Tuesday night meeting that we already had scheduled. It was not clear for me, and it did not just involve one high school. We just heard that half of our high schools have this program / VHSL sport, whatever you want to call it, in their schools. So it is not one school specific. But I do agree that this has, again, become very, very, very disturbing and sad that Ms. Melnick and Ms. Rye would not add this simple item to an agenda that was not full, and we could have handled this tomorrow night.
All right, I believe that wraps this up. So that brings us to action item number 4, resolution to make masks optional in Virginia Beach City Public Schools. So would we please read the resolution, Mrs. Hughes, to introduce the motion?
Whereas the school board of the city of Virginia Beach, Virginia is committed to the physical safety and emotional well-being of all students and staff, as well as being committed to providing the least restrictive environment for all students, and whereas multiple states have lifted all mask mandates with no increase in COVID numbers, and whereas other divisions in Virginia are making mask optional, and whereas other divisions with similar populations and demographics as the Virginia Beach City Public Schools who have implemented a mask optional policy have the same or lower numbers of COVID positive cases, and whereas the state of emergency expired on June 30th, 2021, and whereas all Virginia Beach City Public School staff has had an opportunity to become fully vaccinated, and whereas Virginia Beach City Public Schools acknowledges that parents are best suited to make decisions for their children, now therefore be it resolved that mask face coverings shall be optional in all Virginia Beach City Public Schools buildings and offices, both indoors and outdoors, and this policy shall be in effect beginning January 3rd, 2022. Be it further resolved that it will not be the policy of Virginia Beach City Public Schools to either encourage or discourage any student, staff member, or guest to wear a mask or face covering.
I'm not sure if that represents an actual
You need a
motion. I
second. I think you need a second. It
Okay.
has a motion.
Mrs. Manning, a second. All right, so again, we'll allow those ladies who requested this action item to introduce discussion.
So I did place some documents at everybody's seat before we started. The health emergency, the state of emergency did end June 30th, 2021, as it was supposed to, unless the governor reinstated it, which he did not. Even though he did not, the health commissioner made a health order. And as I looked, the health commissioner is only supposed to be making health orders in the state of emergency. However, I had someone forward an email that she sent, and she gave me her permission to use this, although I did redact her name and her email address. So this person sent an email to Dr. Oliver, which says, "Good afternoon, I hope this email finds you well. Please advise as to the repercussions a school system would face if they went against your public health order and no longer required masks within their schools. I do not see any disciplinary actions documented in your public health order. Respectfully," and was the person's name under. So Dr. Oliver responded, "Hello, as you noted, there are no disciplinary actions associated with my public health emergency order for masking for all faculty, staff, and students in our K-12 schools. Such disciplinary actions can only be taken by school administrations in the local jurisdictions. Best regards, Norm." So this same person sent a FOIA request to the governor's office to find out if any disciplinary actions had been taken against any schools. And the email that came back from Jessica Killeen, who is Deputy Counsel to Ralph Northam, says, "The Office of the Governor is in receipt of your request under the Virginia Freedom of Information Act. You requested, I am interested in detailed information regarding the repercussions school divisions face from the governor's office or the state of Virginia if they change their mask policy to optional." And the response to the FOIA was, "There are no documents responsive to your request. Thank you for contacting the Office of the Governor. Have a good day." So according to the health commissioner, there are no repercussions. According to the governor, no actions have been taken. And the last document has some comparable school districts, some that have mask mandates and some that have mask optional. And if you look through them, the ones that have mask optional have the same or lower numbers than those who have a mask mandate in place. Given the fact that we're not seeing higher numbers at those places,
That would be
and given the fact
reported
that there's no
numbers.
disciplinary action taken, I do not see a reason to continue forcing people to be masked up all day long. Some people are fine with it and some people are not, but parents, not government officials, are best suited to make health decisions for their children. I do not take any issue with someone who wants to wear one. I do not take any issue with someone who does not want to wear one. But ultimately, parents need to be making these decisions for their children. And I think that you need to allow parents to be parents.
Okay, thank you. Anybody else? Mrs. Franklin?
Thank you. I've been kind of out of this discussion, and I appreciate everybody's flexibility with my schedule. But just, I want people to know that I did actually take the time to read the emails, all emails that we received on this issue. And, you know, I am certainly, an avid hand washer. I have complied with the mask request. And one thing that has just kind of has come to my mind is a couple points. First of all, I just had a friend's husband pass away from a brain aneurysm at 51 years old. I know that doesn't sound like it applies in this situation, but I feel like there's a similarity in the sense that he had done everything that he was asked by his doctor and his family to do, lose weight, because he had pre-existing conditions and stuff like that. And, he lost weight, he had a change in lifestyle, exercised. He took all these precautions and he still passed away at 51 with a brain aneurysm. And so that just kind of told me that we can take as many precautions as we want. Ultimately, there is still the chance that things can happen. And, we have done so much to accommodate these, the CDC guidelines and everything else. And, but now we're in a position where for 9 weeks, we've had the opportunity for 5 and older to be vaccinated. And, I assume that the people that probably would have gotten vaccinated also are in favor of masks. But my daughter just, she is an avid masker. She's been very careful because she's just recently had a wedding. And post-wedding, she's gotten a wicked strain of the flu. And so I just feel like no matter how many precautions that we take, there's always the possibility that something can happen. People that get a vaccination, which I have, can still get COVID and can still get the flu. And I just feel like, there could be the Omicron virus, but then it's going to be the Pi virus. I mean, there's constantly a change to the flu and to COVID in terms of what comes next, because that's how, these viruses work.
That's
And I
because
just
people
feel
aren't
like
vaccinating
if you
or
believe
masking.
that there is importance to social emotional welfare when it comes to other issues, then you have to look at the social emotional damage that it's doing. I was at an event the other day with students, and I had to tell them that I was smiling behind my mask because I was so proud of them. I'm smiling behind this mask because, yes, your eyes can light up, you can do different things, but they don't know that. And and I just feel like there's always going to be the next strain of the virus, because we've learned that with the flu. You might get the flu shot and you still might get some aspect of the flu because it doesn't have the possibility of hitting every single strain. And I feel like we have got to get to the point where I still would love, requests for hand washing, maybe social distancing, do as much as possible. But I wish that we could get away and start pulling back on the masks, just because there's so many.
We can if people get
There's so
vaccinated
much that is
and
happening
actually
right now
wear the masks
with,
like they're supposed to. But people are
emotional
idiots.
welfare as well. And again, I just feel like that we need to figure out some ways to take precautions but get back to some sense of normalcy, because this COVID situation could be going on
Things
for a very
aren't going
long
to
time.
get normal the way they're
So I
going.
would like to figure out a way to do that. And this is, post the winter break, and hopefully we can have a situation where we can at least start the next semester or the next year with something where that the students can feel like they're getting back to normal in some sense. Thank you.
And Mrs. Anderson.
So at our last meeting, we were given a plan. Could someone reiterate that for me at this point in time? Dr. Robertson, do you think you can kind of reiterate what our plan was at the last meeting? It had to do with the fact that being that we have people are going to be traveling a lot, there's going to be a lot of interaction. I believe our plan had to do with something about mid-January or a little later, just a little bit later than that, didn't it?
That's
Okay,
correct.
if you-
We're
could
going to
you-
come back to
Could you reiterate that plan for us, please?
Yeah, so we're going to come back to you on January 11th and give you an update on the status of our data as a result of not quarantining our students in high school right now. And we had, working with the health department, established some thresholds for the transmission rate that would trigger the removal of face coverings. So we're prepared to bring that plan back to the board on January 11th.
So I've visited several schools in the last few weeks, and one of the things that I have noticed is that it is kind of impossible, especially in the secondary schools, to keep the distance. They're packed in there. They're packed in there pretty closely in most classes, and so one of the mitigation strategies that we have is the masking, because the kids are so close together, especially on the secondary level. But they're close together even on the elementary level. I was in an elementary school today, and, the teacher had their desks 3 feet apart. That's about as far as she could get them since there were so many students. And the students, they all had their masks on. Nobody was complaining. But I'm not saying that that's the reason to keep it. But I'm just saying that we did have a plan in place where we would look at the data after the holidays. And I feel like that's important. There are going to be a lot of people traveling. There are going to be a lot of people together in groups. And with this new Omicron virus that they say people are saying, spreads so easily, it might not be as severe. That's the good news. But I do think we need to keep that in mind and hold off on doing an immediate, everybody remove their mask type thing until we find out what the data is and what we're looking at on January 11th. So that's just my input on this.
Okay, Mrs. Hughes, then Mrs. Holtz.
So I have not seen anyone show any data showing that masks are effective. The only answer you get is the data is that schools are open. That's not data. That's like saying there are people who have smoked that are still alive, so smoking's good for you. That's not data. That is, well, it's not data. But, as Ms. Franklin pointed out, there's always going to be a new variant, just like the flu. This is never going to end unless somebody takes a stand and puts these children first and says,
Wearing a mask
we do have
puts
to
them
build up immunity.
first.
Everybody who wants to be vaccinated, they have the opportunity to do that. If you're saying you have to be vaccinated and wear a mask, you're telling me your vaccination doesn't work. At some point, you're just going to have to realize the world can be a scary place. People are supposed to build up immunity or get vaccinated or distance if that's what they feel like they need to do. But every time you get close, somebody's going to say there's a new variant that apparently we can't isolate when we test, but we just know it's there, and so we need to do this just a little bit longer. We are now almost 2 years into 2 weeks to flatten the curve. This is never going to end unless people grow some backbones and just start moving forward.
Mrs. Holtz. I'll just kindly remind our audience to remain quiet while our colleagues are speaking. Okay.
Thank you. Well, we're all eager to get back to more normalcy, to get rid of the mask, but doing it in the winter, when a new and a very contagious variant seems foolish and short-sighted to me. Just Friday, the Virginia Beach Juvenile and Domestic Relations Court announced that they would be closed all week, starting today, Monday, until the 27th, only because they wanted to respond to a new and positive COVID-19 activity. So they wanted to protect families, kids, and parents from that. So they're concerned about it. Why aren't we? Masks work best when everyone is wearing them. That's the problem right now. Everybody isn't wearing them. And it's such a small and simple thing to do to keep our kids healthy and safe in school. So
Thank you.
I feel it's the height of irresponsibility to even consider removing masks when we're in the middle of yet another surge. And we know it will happen, as several people mentioned it. We've got Christmas, we've got New Year's. So I cannot support this resolution. We have a plan that was thought out very carefully. We all agree to it. With the start of the plan, schools finally open 5 days a week. Stick to the plan, but I certainly won't support this resolution. Thank you.
Mrs. Manning, then Ms. Owens.
So first I want to say that I very much support those who strongly believe in the need for their children or employees to wear masks. I fully support that and think that's important. But I also fully support those families and employees who believe that they shouldn't wear masks. This is about choice. This is about liberty. This is about
bull.
freedom. It's
No.
about medical freedom.
No, it's not. No, it's not.
It was mentioned that we have a plan. No, we don't have a plan. We've had ideas presented to us. And it's our job to determine if those ideas are best for our students and our employees. It was presented in one of those ideas that 60% of our elementary school kids would need to be vaccinated before the masks would be removed. That's just not realistic. It's not going to happen. 60% of our elementary school kids most likely will never be vaccinated. I don't even know if we're at that rate for our high school kids right now. But there is hesitation of the vaccine and side effects of the vaccines for our children. And I fully support anyone who wants to get the vaccine. I am not anti-vaccine. The flu is running rampant right now. I don't know if anybody's tracked the flu. I track the flu still. And we are at a very high level of the flu right now, as we have always been in years past, except for last year. There apparently was no flu last year. But we've never required masks when we've been at a high level for the flu. And the flu is more dangerous for our children than COVID. So I just don't get this. I've been hearing for the last year from this board, oh, well, let's hold off. Let's hold off. It's Labor Day. Let's hold off. Let's hold off. It's Thanksgiving holiday. Let's hold off. It's Christmas holiday. Let's hold off and see what happens. It's spring break. Look, we might have a surge. We might have this. We might have that. I've been hearing that for a year. I looked over this data that's in the document. The public has it on the website as well, regarding
cherry-picked
mask-mandated
data.
schools and mask-optional schools. These are comparable school districts for the most part. I've seen some studies that people have sent us or that have been in the news, but they don't tell you that this is a very small school district or it's a large school district. I felt that it was important that we compare districts of similar sizes. And I looked at the Fulton County, Georgia school district that's on here, the link, and I looked at their updated data from this past week. And it showed that they had 194 total cases out of 93,978 people. That includes the students and the staff. 194 cases. Their whole district, students and staff, almost 94,000 people. That's a 2.1% rate of people who were positive. So I checked. Dr. Robertson just sent us our Virginia Beach numbers. For the dates were almost the same. It was off by 1 day. Almost the exact same positivity rate. Yet we require masks. So basically there was zero difference yet children could choose whether or not they were going to wear masks. So this is hard data here that's in this document. It's hard data of what other districts have already done successfully. And they've kept their schools open, and the COVID rates in some of these school districts are drastically lower than ours. I'm hearing from employees and parents and children, and Ms. Franklin mentioned it, the damage that these masks are doing to our children, to their learning. Many of you were teachers, elementary school teachers. How can you say it's okay to teach a child how to read or to speak when you're wearing a mask and when they're wearing a mask? And they're trying to form their speech and their words, and they're already behind. How can you say this is okay? It is not okay. And I think this is borderline abuse.
Yeah, on your part.
Ms. Owens, and then we'll ask, I have a question for Mrs. Linetti.
Thank you. I will be brief. I am not in support of the current resolution. I am okay with having conversations, though, hearing differing opinions, and at some point, when we have the public health experts who we're working with on our planning on board, feeling like this is a safe decision for our students and staff, then yes, we all look forward to seeing masks be able to be safely removed. But we did just get the COVID numbers from Dr. Robertson. Our report does show that this week we have double the cases that we had last week of COVID positives in our school with masks. We're moving into the holiday spike, and so the idea of removing the mask now while our numbers are doubling just does not make logical sense to me. So yes, at some point when the public health experts are feeling like that is a safe move to make, I look forward to us being able to do that. But at this time, I don't support this and I'll be voting no. Thank you.
Okay, so Ms. Owens reminded us of the input of the ongoing input of our public health department, including the last meeting that's been referenced earlier, the December 7th COVID update. Mrs. Linetti, so this doesn't get lost in the shuffle, can you share with us just the present ramifications of this resolution should it be approved?
Well, I reminded one that the federal government has an order for any public transportation, you must be masked. That would be employees and students. You would be in violation of the federal order if you took off the mask, if you didn't have a required mask exemption for that. Your Virginia Department of Labor and Industry also requires that your employees be masked. They have violations, which I believe the 2021 is about 14,000. I'm not sure what it'll be in 2022, but that's per violation. They can go up to as much as $150,000 for willful violations, each violation. So you would be in violation of the Virginia Department of Labor and Industry's requirements for employees. I'm not sure why they're telling you that the Virginia Department of Health doesn't have penalties. Virginia Code 32.127 sets forth penalties, injunctions, civil penalties, and charges that can be applied to orders of the Board of Health or the Commissioner. So there are potential that they could come after you for that. So I would have concerns about that. I will also note for you last year, the General Assembly passed forth, at the time was Senate Bill 1303, which required that you have in-person instruction, and it must be in compliance with CDC regulations. And VDH also follows the CDC regulations. When I've currently checked, I see no changes to the masking requirements, recommendations. Again, I think when you're looking at CDC and Virginia Department of Health, it's depending on what's going on in your school division. So I would suggest at that point you look at your Virginia Department of Health. representatives on what they're suggesting is appropriate for the health mitigation layers and strategies that you're using. And one school district may be different than another. So I do have some concerns that if you attempted to remove it for employees, that would be in violation of Virginia Department of Labor and Industries requirements. Federal requirements on public transportation would be an issue for us. I'm not clear why someone's indicating, and through some emails, that they don't have the ability to enforce a public order by the Commissioner of Health, but there does appear to be authority in the Virginia Code for it. I
think
do
the
not
comment was
represent
it hadn't been
the
done.
Department of Health. I do not represent the Commissioner. That would be the Virginia Attorney General's office. So I can't specifically answer how they would handle it. I just know that the code allows for penalties and violations. So I would have those concerns that you might be in violation of either a state law or a regulation or order, and obviously a federal law that deals specifically with this. So I would suggest that when you're looking at CDC or VDH guidelines, you're working with what is being suggested by your local representatives as appropriate for your school division and the mitigation health layers that you have at your school division. And if they say it's okay, then I don't think you're going to have an issue. But if they're suggesting it's not okay, that might be a problem for you. I can't tell you how they would enforce it. That would be the Virginia Attorney General's office that would do the enforcement.
Okay, well, thank you for clarifying the present statutes and such. Mrs. Franklin?
I'm sorry, so, and this might have already been discussed, and if so, I apologize. Okay, so if we're having a discussion or an update on January 11th, then how does that change what you just mentioned in terms of the Department of Transportation and the Department of Labor? So would we still be subject to all of that even after our discussion on the 11th? I'm just a little bit confused about if we were going to have a discussion about masks on the 11th, how does what you mentioned change?
I didn't hear that we were having a discussion on masks. I heard that you were having your update where you were with COVID numbers and how you're doing health mitigation strategies. But the federal order on public transportation, and I checked that a couple hours ago, is not changed. So unless that changes, you're still subject on your transportation to the federal order requiring masking. The Department of Labor and Industry regulations, again, I checked that a couple hours ago. It has not changed. I do not believe they're due to meet until the first week in January. So you're still subject for your employees to that regulation. At the moment, I have not seen the August public health order requiring masks in K-12 education being removed. Obviously, that could change at some point. It is still in effect at this point. As to enforcement of that I don't have responsibility for enforcement of that. I would just look to the Virginia Attorney General's office as to how they would enforce that.
And can I ask Dr. Robertson, because the last set of, the PowerPoint slide on December 7th listed January 24th as
Correct.
the update for monitoring the relaxation of the quarantine.
That's correct. January 11th, we'll have another update on how we're doing, but we were going to use the January 24th date as the date by which we would assess the elimination of quarantine at high schools, because that would give us data before the holiday and a couple of weeks of data after the holiday.
And if I recall, there was some dual rationale to that. It's 3 weeks post-holiday, which is kind of the recognized incubation period. And it's, we need to acknowledge there's a new administration. And so this would be, we would have our new governor sworn in at that point. So the date made sense for a lot of reasons.
That's correct.
Right. Okay.
Ms. Weems has her hand raised to be put in the queue.
I'm sorry, can I just finish my question there? Before, can I just finish? So, are we are or we are not on January 11th, but we're just getting an update on January 11th, or are we actually discussing the potential of relaxing?
So part of the update, as we've always done, is kind of a preview of what we're thinking about for the January 25th meeting, I think is the 11th and the 25th. So it's an update, which will give you, again, a preview of our thinking, as we've always done in every meeting.
Okay, all right, just because, okay. So if this resolution, right now, it does not actually discuss the kids being masked on buses?
Okay, Mrs. Franklin? Okay, Mrs. Hughes, then Mrs. Weems.
So this actually does not address buses. And honestly, if children only had to wear them on buses, that really wouldn't be it's a very small part of the day. I don't think they should have to wear them there either, but we're not going to buck federal law, obviously. 1303 did say we would follow guidelines to the extent practicable. That's not an absolute. I feel that these masks, the children being sitting in these things all day long is damaging. That is not practicable. What else here? Department of Labor, can't do anything about that. And we could advocate for our staff, but currently we need to advocate for our students because we're able to. As far as the experts at Virginia Department of Health, they make recommendations, they make guidelines, but so far we've had 2 experts come in and speak. The first one would read off of something scripted, and if you tried to ask a question, she was suddenly double booked and had to go. The second one we had was citing things like this Mayo Clinic study, which is apparently not even a peer-reviewed study, according to the doctor that I spoke to about these studies. We did have someone just email in about the flu, because Ms. Manning mentioned there was no flu last year. Right on the CDC website, they said that they weren't tracking flu once COVID was here. That's why the snide remarks about COVID curing flu, because they just chose not to track it. And the last part's a question. This governor has said that once he's inaugurated, he's going to eliminate mandates. Do y'all still plan on making these people wear masks all day long if the mandates go away? Because you won't be able to use a health order as an excuse then. What are you going to do when he's inaugurated? You still plan on doing that?
We're not here to speculate. That's why the January 24th date makes sense for many reasons, because there might be different orders in place or not, or rescinded, and we'll evaluate the developments as they arise. But right now, we know what's in place now, and we know what could be in place in January, which is why it makes sense to plan to reassess everything, including on the political scene on January 24th.
It makes sense to stop trying to control people and control everybody's medical decisions. I am seeing the people who don't want to wear masks or don't want to get vaccinated, they're not telling you you shouldn't do it, but the people who want you to do it are demanding that you make the same decisions they make, because apparently yours doesn't work unless they can control what you're doing. You are damaging these children by choice.
Okay. Mrs. Weems?
Yes, Ms. Linetti.
Yes, ma'am.
So all the laws and statutes and all that you just quoted, so are our dear friends in Chesapeake, are they just violating, just rampantly violating the law? Because they just voted.
It is my understanding that their attorney did advise them as to the consequences, the exact same thing that I just advised you, and they chose to take the action they did.
Okay, good. So yeah, I was going to bring up that too about transportation. I have no problem, of course, having children wear a mask for the 15, 20, 30 minutes to school. That's, on a bus, if that has to be. I will definitely, be okay with that. That's a far cry from 7.5, 8 hours straight, whatever. But it just, again, this is like my colleagues have said, this is about choice. We've got hard data that shows there's really no difference between large school systems that have made mandates or have made masks optional. Okay, we have private schools, many in the area, who have made masks optional. They are not closing down. They are not having huge outbreaks. I
that are
went to church
reported.
2 weeks ago, no masks. I was in the mall last week, hardly saw a mask. The masks I do see are below everybody's noses. The majority of them are children out in the public, are not worn correctly. You go to skating parties, birthday parties, the trampoline parks, every place I'm going, the children are not wearing masks. The only place they're wearing masks are in our schools and in some medical facilities. I was in a medical facility facilities the other day, they didn't require masks. So it is just, beyond belief that the kids are not wearing masks, except for when they're forced to, and they're forced to in an environment that is very detrimental to their learning. Especially
I'd
these
like to see the
lower grades.
data on
And
that.
I see it firsthand in the kids that I'm tutoring, their speech pronunciation, their reading, their everything. It has made a huge negative impact. I just don't.
Could that have something to do
understand,
with her
again, why we
tutoring
can't go
ability?
with choice, and then if the majority of the people, which I don't think it will be, but if it is, that's great. If the majority of the people want to get vaccines and wear one mask or two masks and want to wear them, 24 hours a day, that is fine. But again, let people choose. The data shows there is not much difference. And again, like like Jennifer said, this is not going away. And I remember kind of jokingly about 2 years ago, I asked this question on the dais: are we just going to start wearing masks all the time when flu comes and when everything comes? Boy, did I not ever think that was going to be true. And now I'm scared that after this, we're going to evaluate in January, then spring break's going to come, and then we're going to have to evaluate after that. Last summer, a surge came, so we're going to have to wait till after summer, and it's going to be ongoing and ongoing and ongoing. This is the time to let people choose and let people make their medical choices. It is not our responsibility.
Okay, and we have one more in the queue, Mrs. Melnick.
Just a couple of things. First of all, we are going away. People are going to be out doing things and coming back. I don't think it's unfair to wait until that January 11th presentation. Things may change on January 15th, and there you have it. However, when you're going to start citing different schools and their data, what you should have told the public was that Fulton County, Georgia had 27 cases when children were wearing masks. And then they made masks optional, and within a week their cases were 197. And so you have to share that in the proper context. And when we compare to private schools, as we've talked about before, take Norfolk Academy, grades 1 through 12, there are less students in Norfolk Academy, grades 1 through 12, spread out, than there are at Kellam High School with a population of 2,100 students. And so we're dealing with different numbers. And I think we've done a remarkable job muddling through this. I don't like this either. It's a rule in this building and I follow it. I'm triple vaccinated. I don't care about anybody else and what you're doing, but it's important and we're trying to do right by everybody, all of our kids and all of our employees. And I look forward to the presentation on January 11th.
Okay, final call, Mrs. Manning.
Yeah, so that data is not correct. I have it right here. October the 1st through October the 7th, Fulton County still had their mask mandate. And on that date, they had 111 cases while they still had the mandate. And on November the 12th through the 18th, they had 81. So
83.
they had 81 after they lifted it. And they had 111 prior to lifting it. So that data is incorrect.
Well, we'll be sure to have all that information and more available to us in January by staff. All right. So,
Can I just say that we're not Georgia, we're not Alabama, we're not Florida, we're Virginia Beach. And we need to look at our own numbers.
There were
and
no
do our
numbers
own
in Virginia
comparisons
to
at
compare
this
it to
time.
because the whole state is
Excuse me.
mandate.
okay, the discussion is closed. So with that, the resolution on the floor, all in favor, please show a raised hand.
Mrs. Weems, how do you vote?
Yes, in favor.
Thank you. Madam Chair, we have 3 ayes.
Okay, all opposed to the resolution, kindly show a raised hand. Please.
Ms. Owens, how do you vote?
No.
Thank you. We have 3 ayes and 7 nays. The motion did not pass.
Wait, who's 3 and 7? Wait, is somebody,
We have 8 nays and 3 ayes. The motion did not pass.
thank you, Madam Clerk, and with that, we are adjourned. Thank you all.